Kia ora and welcome to my presentation on type 1 diabetes. Okay, so today what I'll be talking about is what types of diabetes there are, who can get diabetes, and what diabetes are we talking about today. So the first one is there's different types of diabetes. You can have type 1 diabetes, which is where the body cannot produce insulin. There's type 2 diabetes, which is actually quite common in New Zealand due to people's eating habits. And you can also get gestational diabetes when you're pregnant as well. But today I'll be talking about type 1 diabetes because I live with a person who has type 1 diabetes, and it's interesting to me. So basically, type 1 diabetes is where the body cannot create enough insulin to keep its sugar levels at a decent level. So what they usually have to do is inject insulin, which I'll talk a bit about later. So mostly it occurs during childhood, such like my partner, it came out about when he was 12, and usually it's between children between the ages of 7 to 12 where it can arise, but it can arise at any age at all. And I do have a video here, Tracy, to watch in regards to type 1 diabetes, but I won't play it now. So the symptoms of type 1 diabetes, I chose this one with the age under 30 just because our class is mainly under that age. So some people who don't suffer from type 1 diabetes, symptoms can be excessive thirst, frequent urination, weight loss, blurred vision and fatigue. And sometimes if it actually is quite extreme, they can have extreme hunger, poor concentration, and if it's not treated properly, type 1 diabetes can lead to eyesight issues, circulation problems, and extreme conditions. It can lead to gangrene or even can be fatal, which we really don't want to happen. So basically, the diagnosis for type 1 diabetes, they do that through a blood test, which is called a HbA1c. And that what it does is measures the amount of glucose that is in the blood over a 3-month period. So if a high HbA1c results, it will show the diagnosis. And usually no other test is required, but other tests to measure the amount of glucose in your blood can also be used. In the past, they used to use urine tests to detect diabetes. I don't know how they figured that out through urine. Okay, so the treatment for people who have been diagnosed with type 1 diabetes, in this picture here you'll see this is my partner's stuff that he has. He's got a reusable insulin pen, disposable insulin pens, and he's also got a blood sugar level testing meter and a lance which he uses to pierce his finger to get that blood sample, which goes into the machine, which will give him the reading of what his blood glucose level is at. So this is a daily routine for people who have type 1 diabetes. They test their blood sugar with the little meter there, and that will tell them basically how much insulin they have to use to get their level B cells to a constant level, so they're not going to get sick or anything like that. Many people will use the pump, and it's a lifelong thing. They don't just do it whenever they feel like it. It's for the rest of their life. So basically, through my presentation, type 1 diabetes is for life. Some people who have been diagnosed with type 2 diabetes through a change in their diet and the way that they live their lifestyle, they can actually stop being diabetic and have their blood sugar at what we'd call a normal level. So maintenance is the key to managing a healthy life for people who are on diabetic medications, such as the pens. There's different names, and some work for some people, some work for others. It depends on what medication they're on, I guess. Regular BSL testing, the blood sugar level testing, just to make sure that they're able to live what we call a normal healthy life. So body's getting that insulin that they need to keep that blood sugar level at a good level or healthy level. And diabetes is manageable with the right advice. There's, for instance, our local doctor, we have a diabetes nurse. She also goes and visits people as well in their homes and can give them advice professional advice on how they can live a healthy life with diabetes. So there's my references there for you, Tracy. I hope that you've enjoyed my presentation, and I will see you again in the new year. Bye. Thanks.